Well, good morning, everyone. We want to welcome you to another amazing edition of Weekly Wellness with your girl, Comedian Joy, and the awesome, wonderful Dr. Mia Cowan. And so we have another great segment. But Dr. Mia, how are you this morning?
I am fantastic. How are you doing, Comedian Joy?
I am well, always excited, not only to do these segments, but I often, always learn something new. And this week, we're going to talk about something. Some of y'all may not want to hear, but it's true. We're going to talk about that, your risk for them diabetes. If you're old school, it's the sugar. And what does sugar have to do with Dr. Mia and infertility? That's what it got to do with you. Isn't that right, Dr. Mia?
That's right. That's right. That's right. So yeah, we wanted to talk a little bit, but first, Joy, Comedian Joy, tell the people who you are so they know who they're talking to.
That's what I'm saying. Y'all don't know me. I tell people I'm your entertainment specialist. I'm comedian Joy that hosts the most amazing bus food tours. I'm also your favorite girl when it comes to travel. I'm your travel agent. So in transportation travel, I'm your girl. I get to have amazing people like Dr. Mia on the panel and tell you about the great places to eat at, the great places you want to vacation at. And when my energy run low, I tell y'all where to go and get you some energy so you can be on fire like I am this morning. Because I go to the one and only Me Bella Wellness with Dr. Mia and her amazing team that'll take care of you.
All right.
And
She
then
knows
Dr.
how to make a lady good. And for those of you who don't know, I'm Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology to women and adolescents. And that's what we'll be focused on today. But we also offer hormone pellet therapy, weight management, total wellness solutions with supplements, intimacy services, and laser hair removal to both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. So, like comedian Joy said, today we're going to be talking a little bit about infertility, obesity, and a little bit about PCOS and how obesity actually affects fertility.
So, Dr. Mia, if we go by the charts, if you have so much a percentage of body mass, you are obese. So right now, I looked at some of my medical stuff. It called me not just obese, but morbidly obese. And I know more people that are more obeser than me. I don't even know if that's a word. But Dr. Mia, can we have that chart in different sizes, like baby obese, almost obese? Watch out now. Why they gotta call me morbidly obese?
I know they make it sound so morbid. So
Right.
yeah, but like comedian Joy said, that's true. Like we do define your weight and your BMI based on the real number. So it's your height and your weight. It's not different for black women. It's not different for black women who come from families with big bones. It's the same. So we got to define it as what it is. And so it is true that being overweight or obese can decrease fertility. And it does it a few different ways. One, it does it by insulin resistance. So if you are from a family that may already be overweight and they tend to have diabetes, some of the things that you may notice is that you're starting to skip cycles, you're getting more hair and acne on your face. You may notice thinning hair. You may notice that it's harder to lose weight and that you're gaining a lot of weight in your belly. And for those women, it can be more difficult to get pregnant. So one of the things that we do when I'm working with a patient who's been trying to get pregnant, we consider you infertile if you've been trying to get pregnant for a year and you're actually timing your intercourse to make sure that you're doing it's during those ovulation times. So what I tell people is the first day of bleeding, it's the first sight of blood, which is the first day of your cycle. That's
What
day
now?
one. So the first day of bleeding is the first sight of blood, which is day one of your cycle. So a lot of people are like, well, I started my period on September the 8th, but I started spotting on September the 5th. Well, September 5th is day one, not September 8th when the bleeding got heavy.
Well, I thought if your cycle is on, that's your free time that you couldn't get pregnant. So
Right.
that's
So that's
kind of
what
how
I'm
I
about
got
to
my daughter.
explain. That's right. That's what I'm about to explain. So day one is the first sight of blood. Most women are going to be fertile between days 10 and 17. So what we say is you ovulate on day 14, but what we know is everybody's not going to ovulate exactly on day 14. So in order to hit that window when you're fertile and you need to have unprotected intercourse to get pregnant, I outline that as days 10 through 17 of your cycle when you count day 1 as the first sight of blood, which is the first day of your cycle, whether that's heavy or whether that's light. So if you're trying to get pregnant, you're going to have unprotected intercourse every other day between days 10 and 17, at least, because sperm usually lasts about 72 hours. So if you got some sperm that's not as strong and healthy, every other day between days 10 and 17, you should definitely hit your ovulation day. So
So
if you've
it's
been
just
doing,
sitting in there.
yeah, the egg is waiting to be to be fertilized. So that's about the time that it should be in there between days 10 and 17 if you're ovulating. Now the problem with insulin resistance is you may not be ovulating, which is why, and a sign of not ovulating is skipping cycles. So if you're not having regular monthly cycles, that's a sign that you're not ovulating. So it's three things that you need to be fertile. You need to ovulate, you need good male sperm, and you need your tubes to work well. Okay, so if you have scarring of your tubes, the egg can't get into the uterus. So that's one thing we always work up with infertility. We make sure your tubes are open. There's a little procedure that we can do in radiology where we shoot the dye to make sure both of your tubes are open. Well, once we know both of your tubes are open, the next thing is, are you having regular monthly cycles? Because if you're not having regular monthly cycles, that means you're not ovulating. So we got to work on your hormones and your ovulation, which can negatively be affected by PCOS and skipping cycles. And then the other thing we want to make sure of is the male factor. We want to make sure that the sperm works. So those are the three things that we look at when we're trying to rule out reasons why you didn't get pregnant. Is it something going on with your tubes? Is it something going on with your ovulation and your hormone levels? Is it something going on with the sperm that's trying to fertilize the egg?
So once you rule out the first two, then that's where obviously you start testing the sperm.
Right. So, well, I always have them to do both because I know you're ovulating, I want to figure out what's going on with him and what's going on with her. What's going on with your sperm? Is it able to get to the egg? Are you, producing enough sperm to fertilize the egg? Is it moving like it's supposed to fertilize the egg? And then for the woman, I want to make sure your tubes are open because we can't get that egg into the uterus if your tubes are not working. So first is ovulation. Once we know you're ovulating, what's going on with the tubes? What's going on with the sperm? Once we rule all that out, then we're like, okay, you're not ovulating because we tested, your cycles are kind of irregular. So the next thing we do is get some blood work and see where some of your levels are. So one of the levels we look at is AMH, the anti-Müllerian hormone, and that tells us if you have some good eggs. So if that's over one, we're like, okay, so that's not an issue. For the ovulation component, the way we realize whether you're ovulating is you can do an ovulation kit and test and see if it turns positive and if you're actually ovulating. But remember, a good sign is that you having regular monthly cycles. So the next thing we'll check if your cycles are regular is, do you have enough progesterone during the days 16 or days 18 to 24? So we check a progesterone level and we like that level to be well over 8. So when we know you're ovulating and you got plenty of progesterone, the sperm works well, and the tubes work well, we know you're going to need to keep on trying. Down the road, if you're having a lot of pain, we want to rule out endometriosis. We get an ultrasound. Sometimes we have to do a laparoscopy, but usually it's one of those first three things. And a lot of times with our women now, it's that they're not ovulating because they have PCOS. So what we want to do is diet change, exercise, control the blood sugars, decrease that hemoglobin A1C, maybe start some metformin, maybe start some progesterone, and sometimes starting something as simple as a medication to help you ovulate, like Clomid or Letrozole.
So when it comes to diet, because the number one thing that most of us think about for diabetics is sugar. So if someone is trying to get pregnant and may have that issue, is it to eliminate all the sugars and I guess high carbs?
Yeah, so what I won't say eliminate all sugar, but I say decrease your sugar. And a lot of times I will put my patients on a medication, even if their hemoglobin A1C will come back at 5.7 or 5.8 or even 5.6, which is normal. So normal is 5.6 or less. We don't call, we consider you normal, no diabetes, no pre-diabetes. 5.7 to like 6.2 to 3, I'm like, okay, you're pre-diabetic. But to me, I'd go ahead and treat somebody who's trying to get pregnant, even though they're pre-diabetic, go ahead and treat them with metformin And that's going to help lower the insulin levels so they can start ovulating again and increase the risk of pregnancy. And it helps them lose the weight. So one way to help with the insulin levels to improve the hormones is to change your diet. Another way is also to add medication on top of it. So like you said, Comedian Joy, with the diet change, what we want to do is decrease the sugars, the simple sugars, the processed foods, increase your plant-based diet, eat healthier, leaner meats, because that's going to help you with your weight management. And most importantly, monitoring your insulin levels by decreasing the carbs and sugar will help significantly with your hormones so that you're able to ovulate again. So again, it always goes back to healthy weight management, healthy lifestyle, healthy eating, healthy exercise, even when we're talking about fertility.
So what about diet when it comes to the man? I mean, like, is there a particular diet that helps with sperm, healthy sperm
Well,
count?
with the sperm, what does help is not smoking a lot of marijuana because that does lower sperm count. And there are a few other things, but I don't know of anything specific that men can do to help with motility. They end up having to go see a urologist, and there are some medications that men can get to help with the sperm and to help with the motility. And sometimes we get to the point where if it's a real male factor, sometimes they have to do what we call intrauterine insemination, where you actually we put the sperm with the egg manually because the sperm can't move as like it needs to get to the egg on its own. So we actually, you go to an infertility specialist and they actually artificially inseminate the sperm and the eggs already there because if the woman's not having problems with ovulation.
Interesting. So if you are a diabetic patient and you become pregnant, are you at like some type of high risk because you're
Yes.
diabetic?
Yes, yes. And so that's one of the things I talk about to my patients, especially my younger patients who have time. Like, let's get your diabetes under control because when you're diabetic, you have an increased risk for having an early miscarriage. You're at increased risk for stillbirth. You're at increased risk for trauma during pregnancy and delivery because the baby can get so large if you have uncontrolled blood sugars. And then you're at increased risk of gestational diabetes. So if you don't have what we call true diabetes and you're more like pre-diabetic, we want to make sure that we get those numbers under control even before you get pregnant because it's going to be a healthier, safer pregnancy for mom and for baby.
Wow, that is interesting. So you also talked about you might have to do the letters again, PCOS. Now that has to do with hair, but does that tie in with diabetes?
Yes, so women who have PCOS are what we consider insulin resistant. So when you're insulin resistant, that means that your insulin levels are higher and you're more likely to not ovulate. So the the change in the hormones from the high insulin levels can cause the acne, the facial hair, the thinning of the hair, the skipping of the cycles, the bigger belly, and like I said, all the increased hair and acne.
So they
So
would
uh,
those patients need to see you because I'm saying because there are some people like me. I grew up hairy. I have extra weight. Both my parents were heavy, but I don't. You know what I'm saying? Like,
you
are
didn't
some
skip
people just?
cycles.
I didn't skip. I was regular like clockwork.
Right. So you would still be considered insulin resistant, and it's still good to monitor your hemoglobin A1C and monitor your diet for a healthier pregnancy. If you have diabetes, then if you already know you have diabetes, then making sure your hemoglobin A1C is at a good level and you're controlling your blood sugars to decrease risk associated with having diabetes in pregnancy, which would be risk for the baby and the mom.
And so
So
if
we
you
want to get you as healthy as we can get you before you even try to get pregnant. So the goal for treatment for PCOS is to control the blood sugars better, to lose the weight and decrease the insulin resistance so that your hormones can level out and you can get pregnant easier.
okay, so yes, you've answered that question. So if you're a diabetic, you need to prepare your body for pregnancy. You just don't need to be all out here wilding out. Oh, it's raining. It's the first Friday I got
And
my
eat.
taxes. Yes.
Yeah. So you got to watch that sugar intake, that carb intake, and remember, sugar isn't alcohol. So be careful with your nightly wine or shot. That also affects your blood sugar level. So basically, comedian Joy, what we basically explain to everybody is that fertility is complicated. So it is important to make sure. But what I do want to impress on everyone is that even though it's complicated, most women are going to be able to get pregnant even though they may require some help. And if you have been trying to get pregnant for over a year and you're actually having time intercourse, especially if your cycles are not regular, you want to go ahead and discuss these things with your gynecologist so you can start getting the proper workup, and we can help you to be as healthy as you possibly can and help you to get pregnant in a healthy state so that you can reach your goal of having a baby. But it's complicated. It's not as simple as doing one or two things. And again, we always go back to creating this healthy lifestyle, living this healthy lifestyle, so that we don't have to deal with as many of the issues during pregnancy and trying to get pregnant.
So then, what about more seasoned women who, maybe they think I'm going through menopause and maybe skip the cycle or two, and they just kind of whatever willy nilly, and oops, there it is, because and then they just get pregnant. I guess that was just one of those miracle babies we call them.
Right. Or they could have just been on birth control like me. If I'm 48 and I know I don't want to have a baby, I just do birth control to make sure I don't get pregnant. Because you can't assume that you can't get pregnant because you're a certain age. So the best thing to do is to be on birth control. And then the final thing I want to say and remind my ladies is that now we're getting pregnant at later ages. We're getting married at later ages. A lot of people are focused on their career. So don't forget about the option of freezing your eggs to make sure that if you decide to get pregnant at an older age, you still have the opportunity to get pregnant at an older age because you've actually planned and frozen your eggs. So for a lot of my professional women who are going to graduate school and going to medical school and going to law school, or some of my women who just get married at a later age and don't want to have a baby without getting married, it's always an option when you're young, especially under 30, to get a workup and decide if you want to get those eggs frozen to increase your chance of being able to get pregnant, even if you're at a more mature age when you're trying.
Now I got questions. Freezing these eggs, how does this work? How do we know that when they throw them out, they gonna be my eggs and not Shanquisha's eggs? How long can they be frozen? They put them in the ice tray. Talk to me, Dr.
Right.
Mia.
So it's a whole process that I can't give you as much information on the specifics of the process, but basically what happens is they're going to give you medication so you can ovulate a lot, and then they're going to go in an office procedure and they're going to retrieve those eggs, and then they're going to store them in a safe environment so that they can be frozen and unfrozen when you're ready to try to get pregnant.
They got a
So it's
10-year life cycle like a car or
I
something?
don't know what the life cycle is, but it's pretty long. It's probably more than 10 years. And they try to do a lot, they try to freeze a lot of eggs to increase the chances of you being able to get a fertilized egg and actually carry it as a pregnancy. So they want a lot of eggs. They don't want one or two. They usually want more like 15 so that they have the option, so that if they don't all take, you got options.
Interesting.
But
Wow.
just, I think the important thing for that conversation is just to remember that that is an option. So if you know you may not get married early, you're getting close to 30, you don't have a prospect, you want to do some other things, and you're probably not going to want to have a baby for a long time. Don't forget about the option of freezing your eggs. If you have a strong family history of like breast cancer or some kind of cancer, it's a chance that you may, have a problem. Freezing those eggs before will allow you to still get pregnant, because after chemotherapy, a lot of women go into what we call a menopause. So just leaving those options open for fertility based on life circumstances, whether that's age, whether that's you getting married later in life, whether that's you having something that affects your eggs in the future. Freezing eggs would be a good option for a lot of women, and I don't want them to forget about that. And I discuss it a lot with my younger women.
Well, I got one question, and this is real. What about when you do have them babies and they get on your nerves? Can you freeze the kids? I'm just saying.
Shut up for me. Some people probably wish they could. But at the end of the day, the good news is that with technology now, most people are going to be able to get pregnant. Save your ducky, save your money, because it's not a cheap option, but it is a viable option. And I think it's important for us to recognize that so that we can increase the chances of allowing women who want to get pregnant later to have those options. And women who want to get pregnant now, with infertility and the right workups and seeing your doctors and letting them know, I've been trying to get pregnant for a year and nothing has happened. How can you help me? And if that doctor doesn't figure out how to help you and start a workup, find a doctor who will. Because unfortunately, what I see is a lot of our patients, especially my Black patients who've been trying for a while, and they haven't really been offered the right options to ensure that they can get pregnant when they're younger and they're trying. So then they come see me and now they 39 or 40, which makes it even more complicated. But they've been trying for 5 years and just never had that real conversation with the physician they were seeing before me. So now we've wasted a lot of time when if you've been trying for a year and nothing has happened, it's time to get a workup.
Exactly. Wow. But also to go back to you, if you are that person that's insulin resistant and notice all this increased hair, unwanted hair, they can come and see you and you can get rid of it.
That's right. We got laser hair removal and lifestyle change, y'all. Even changing your lifestyle, changing your diet, decreasing your sugar in your diet, exercising, losing weight helps with the hair. So we can do laser hair removal, but to prevent it from growing as quickly, we can make some major lifestyle changes through our weight management program and through our total wellness services so that you can lose the weight, keep it off, and decrease the growth of hair and decrease your chance of ever getting full blown diabetes, which obviously can negatively affect your life chronically.
Exactly. So you always are offering some type of webinar. Do you have any that's upcoming with weight or with the hair removal? What do you have coming up?
Girl, thank you. That's a great question. So, I just did a wonderful webinar. It was just, if I must say so myself, it was very informative. We talked about contraception, fibroids, abnormal bleeding, and menopause. I just did that this past Tuesday. So, we do have a replay. So, if you're interested in the replay, let us know. We can give you the information for the replay. And then, upcoming March 19th, I'll be doing a masterclass on endometriosis and healthy sexual function as we continue to age. So you definitely don't want to miss that. Those are free master classes that we do for our community to make sure that we are educating the community so that you can live well, age well, and experience everlasting intimacy. And finally, on tomorrow, Joseph and I will be, I mean, on Sunday, yeah, tomorrow, we'll be doing ageless intimacy with Dr. Mia and Joseph. So we'll be talking about some interesting conversations on there as well for you to get even more information about healthy living. So, y'all, we appreciate y'all coming on. Comedian Joy, can you do me the pleasure of introducing, I mean, reminding people what you got going on so that they know how to follow you and get on your stuff? Now, I don't know what happened to Comedian Joy, but basically, eat, drink, and ride is what you want to make sure that you look up. And I already put on here her website so you can keep up with everything she's doing. It's Dr. Mia at Me Bella Wellness Center. We appreciate you taking the time out this Saturday morning to learn all that you can about weekly wellness. If you're watching the replay, put hashtag replay in there. And I look forward to seeing you on another weekly wellness as well as ageless intimacy on tomorrow. Y'all have a great rest of your morning and day. Happy Saturday. It's Dr. Mia. I'll see you